The purpose of this presentation is to find partners and sponsors for a project that we all desperately need, and that is to control and have adequate medical supplies for all the hospitals and treatment centers across the U.S. In order to accomplish this, we need to facilitate and prioritize allocation and distribution of all medical supplies that are critical. We need to create a national management of inventory, and we need to prevent over-ordering by the individual facilities. And in addition, we need to have planning of our manufacturing capacity, both from the current and into the future. The requirements for this project is to have a national inventory system that is updated on a real-time basis. Now, I understand that it can't always be real-time, but we want to make it as real-time as possible. We need to identify all the data by medical facility and group the information by company, by state, and on the national level. We need to identify all the vendors and stocking locations of items within the scope of this project. Have current purchase orders and projected demand by week for each medical facility for the next 20 plus weeks. Another requirement is to have a computer model for each facility that projects order quantities by demand, lead time, and supply constraints, with a minimum of 4 order cycles going out into the future. We want to identify current and potential manufacturers that could quickly convert and increase overall capacity. The scope of this project is to cover all medical supplies that are needed for testing, treatment, and vaccination. This includes personal protection equipment, ventilators, COVID-19 test kits, drugs to mitigate symptoms, and eventually treat the symptoms. We want to cover all medical facilities, including hospitals, testing, and treatment centers. And we want to have all the global sources if possible, or as many global sources as possible. An optional thing for the scope of this project may be to look at overall facilities like beds, other equipment, and personnel, but we don't want to attack that initially. We want to focus on the priority of the medical supplies. The deliverables for this project is to have a centralized cloud-based relational database to house all the relevant data. We want to have purchasing models that include all the critical medical supplies and equipment, and we need to provide training of how to input the data, transfer input data, use and maintain the models and the database, and run reports as needed. The timing of this project is going to be relative to when we can get started, and we understand the critical nature and urgency of getting this done. So we want to identify the project sponsors and funding sources first, then identify key decision makers within the medical field, governments, manufacturers, and suppliers, staff up as quickly as possible, design and code. People, the programmers are needed, the communications for getting all the data and identifying who all the stakeholders are. We want to have some media experts so that we can communicate with the public and report on our progress of this project, and have project management, which hopefully supply chain systems is part of. Identify data owners, internal IT managers, and system resources so we can automatically connect and have the right resources available to us when needed. We want to deploy the models to the IT managers, and then we would build and populate the database, automate the feeds, and integrate the database to the models. If you are someone who is a decision maker that can participate in this project, please contact us as quickly as possible. Here is all of my contact information and some of my credentials to show that I have worked on these kinds of projects before and that this is a credible type of effort in order to alleviate the coronavirus-19 crisis that we have. Thank you for your time, and I hope to see you soon.